Dear students, welcome in the class. Today we will discuss about communication skills, breaking bad news in a clinical scenario. Myself, Dr. Dhiren Misra, working as an assistant professor in Department of Psychiatry, Shyamsa Medical College, Riva. Communication is an important skills. It is a fine skills, not a gross skills. It is a fine skills and which is essential for every medical professionals. It is in a backbone for the good patient care. Also helps to maintain a relationship between patients and clinicians, and also improve the level of satisfaction among patient and caregivers about the treatment. Situations like to deliver a bad news to caregiver is a challenging task in a clinical setup, and effective proper if you have an effective and proper skill to deliver a bad news, it's not only mitigate the aggression of attenders but also provide an opportunity to show the empathy toward the patient and patient cares. Although to deliver a bad news in a clinical scenario, various structured protocol is available, uh, but most commonly and worldwide used Spike protocol for structured delivery of bad news. Spike stand S for the setting up the conversation, P for the perception of attenders about the illness, I is invitation, K for knowledge, E for emotions, and S stand for strategy and summary. Now we will discuss one by one. S stand for setting. In what setting we give an information to the patients, or how in what setting we deliver a bad news. So the when we are going to deliver a bad news to patient or caregivers, the room must be quiet and undisturbed area. uh, Also involve the important key people in discussion who is involved in the patient treatment decisions and cares, and sit close to patient and have no barriers between you and patients, and try to be calm and make eye to eye contact so that you can communicate your information uh, more effectively. P denotes for the perception. Assess the understanding of seriousness about clinical conditions. What the patient attender or patient perceive about clinical conditions. You can start your opening statement like, tell me what you understand about your conditions so far. What did the other doctors tell about your clinical conditions? Uh, you can offer, I would like to sure we are on the same page with understanding your conditions. So can you tell me more about what you understand your clinical conditions? Assess the patient and family members level of understanding about clinical conditions of the patient, and take note discrepancy between the actual conditions of patient and what the patient attender or patient perceive. And also important thing is denial. In various situations, various serious conditions, patient was seriously ill but attenders are not able to accept, and most of the time they are in denial mode how this will be possible, or why this how this can be happen with me or my patient. I stand for invitation. Once the patient, you can once you are able to assess the perceptions about the illness among the patient and caregivers. Now, next point is invite the patient to give a more information. But before disclosing information or discussing about the clinical conditions, accept the patient right not to know. Sometimes patient or attenders are, they don't want to know about what is going with them, because it's create a lot of stress and anxiety many times in the patients. uh, so starting inviting the patient or attenders, you can start the opening statement like, I would like to go over the your results. Would you like to be okay to discuss your results? Or you can tell like today my plan is to discuss about your clinical conditions. Is that okay for you? If patient says yes, I am ready, I am open to discuss the results, I am okay to discuss the clinical evidence, then go further. And also offer to answer any questions patient, attendant, or family members uh, they ask uh, about your with you, they ask from you about clinical condition of the patient. Now next point is K for knowledge. Means in previous two steps we are able to assess the perception of patients or attenders. What is the discrepancy between the actual conditions and the patient conditions? Actual condition patient and perception of the patient attenders. Give the information about actual condition of the patients. And when you are trying to give an information, avoid medical jargons. Give the information in simple patient understandable language, and if possible give the information in the patient native language, so they can understand better. And after giving and give an information in small chunks, and giving an information to the patient or caregivers, also check whether they are able to understand what you trying to communicate to them or not. When the patient receive the information about clinical conditions or care, they experience some kind of emotions. It may be the sad, angry, or these kind of emotions. So to deal with these emotions, and to assess the emotional reactions about the illness is an important task. And we can start or use word like open-ended questions or direct question to explore what the patient feeling. We can ask, can you tell me more about how are you feeling? Did that make you angry? Respond to the emotions with empathetic and affirmative statement like, I can see you are not expecting this. Most people would be upset by finding this. So giving an after perceiving the emotions of the patient and caregivers, give them empathetic and affirming statement. Don't give them false assurance like everything will be fine, I have seen a lot of miracles. These avoid to try to avoid these kind of the false reassurance. S stand for strategy and summary. Closing interview. This is the last part of the interview. Decide the what is the best medical plan would be for the patients. Discuss these plans with the patient. What is in your mind, and how you are going to proceed the uh, treatment part, or trying to execute the treatment part about the inpatient care. Collaborate and agree on the plan. Ask the patient to repeat to you their understanding of the plan, and have clear treatment plan in writing for the patient to take home with them. So with the using these spike protocol, we can deliver on a bad news in a structured way, which included everything from start from the setting, perception of the patient or caregivers, what the information actually have, how to provide the relevant information, and after receiving the information, patient attenders feel some kind of emotional reactions, how to manage these kind of emotional reactions, and how to close the interview sessions. Hope so you are able to understand each and every steps of the spike protocol, and able to deliver an effective able to break a bad news in an effective way in your clinical settings. Thank you. Thank you.